Thank you for joining us this afternoon. Give you just a few more seconds to join us here in the webinar, and then we'll go ahead and get started. Thank you for your patience. Okay, well, good afternoon, ladies and gentlemen. Thank you for joining us this afternoon for our statewide vaccination coordination efforts for the visitor industry workforce webinar. We're very honored today to have some very special guests with us to help with this webinar. I'd like to first start off by introducing Mufi Hanneman, the President and CEO of the Hawaii Lodging and Tourism Association. Mayor Hanneman, it's nice to see you. Kathy Ross, the First Deputy Director of the Department of Health. Thank you so much, Kathy, for joining us this afternoon. As well as John DeFries, the President and Chief Executive Officer of the Hawaii Tourism Authority. John, it's nice to see you this afternoon as well. My name is Keith Regan. I'm the Chief Administrative Officer, and I just wanted to welcome you all here today for this webinar. We will be using the question and answer feature of Zoom. So if you do have a question for any one of the panelists from today's presentation, please use the Q&A feature. Please don't use the chat feature. We'll be monitoring that, and then we will present those questions to the panelists when we get to that point in time within this webinar. So again, we thank you for joining us, and I'll turn it over to you, John.
Well, thank you, Keith, and thank you all for joining us this afternoon. When HTA was asked to help coordinate the workforce visitor industry vaccination program, our first interest was in beginning to understand what the Department of Health would interpret as support to them. And so we're here really to provide information about what kind of information DOH will require to be submitted in a uniform manner and consistent to make it more efficient, not only for DOH, but also for each individual employee, so that appointments can be personalized and also people can be directed to the nearest vaccination center. To achieve this initial part of the rollout, which will be multi-phased, we turn to the Hawaii Lodging and Tourism Association that has more than 700 members in every sector of our industry, including hotels. And so at this time, I'd like to call on its president, Mufi Hanneman. Mufi.
Aloha, John, and aloha, everyone, and thank you for joining us. I want to thank John DeFries and HLTA for convening this webinar, as well as one that's to follow this afternoon with those in the expanded aspects of the lodging industry. But most importantly, too, John, initiating the dialogue with the Department of Health. From those meetings came some great ideas, and also we were able to start communicating about the importance of making sure that our hospitality workers would somehow be prioritized in the tiers and the like. And so I can't say enough about the wonderful cooperation and dialogue that has ensued, especially with the woman of the hour that's here today, Deputy Director Kathy Ross, and her boss, Dr. Libby Char. They have been very helpful, and these webinars kind of took a different turn at first. When we thought about it, we thought, well, we may not have a schedule in place yet because it was all based on supply and the like, and working out through many issues that they have to work through. But when it was announced last week that they were ready to target the hotels, restaurants, and bars, and it took a whole different dimension, which is basically many of you have reported back to us how happy you are. The process is proceeding. Some of you even saying that the same day that you scheduled an appointment, that afternoon, you were able to go and get your first shot. So we owe this a lot because of the excellent cooperation and support from Kathy Ross. And I don't know if Kathy sleeps, but she's taken every call that we've made to her. Every email's been answered. Very, very pleased to have her today to lead this discussion with you, especially in the Q&A for some of you that will continue to have questions. Also want to do a special welcome to our friends at the ILW and Local 5 that are joining us today. Truly, we want this to be a partnership right down the line where we're all on the same page together, making sure all of our employees know what they need to do to get vaccinated.
Before we get to Kathy, I also want to say that after Kathy is through presenting and before Q&A starts, I will be calling on Donald Domingo, the head of ILWU, and calling on Eric Gill, the head of Local 5, to bring forward their perspectives and sense of priorities. We recognize that not all of the hotel employees have been recalled at this time, and we're actually looking toward the next 100 days where there's an acceleration in employees coming back. So their vaccination schedules are important, whether they've been recalled formally or not. So without further ado, I'd like to introduce all of you to the first Deputy Director at the Department of Health. Please welcome Kathy Ross. Kathy?
Hi, good afternoon, everybody. Please accept my apologies in advance as I share a presentation with you. I am very comfortable with Teams. I'm not too comfortable with Zoom. I will do my best. I was practicing a little before this, so I hope that this goes smoothly. I just can't thank HTA and HLTA and HVCB, for all of the partnership that the visitor industry has with the Department of Health. It's not a typical partnership, but this pandemic has really brought together so many new partnerships, and I'm really excited that we had this opportunity. If there's a silver lining to the pandemic, it's about building new relationships and new partnerships into the future. So with that, I'll start off by saying I have 15 slides. I'll go through them pretty quickly because we will make them available to everybody participating here, and also HLTA can send it out to its membership organizations for reference. It may be outdated within a week's time, but don't worry about taking notes. We'll make these slides available to you. So I'm going to share my screen right now. On a second. Okay, how am I doing here with this screen? Can you see that?
No, not yet.
Not yet. Okay, hold on a second. How about now?
Yep. Although we can see
Although
the notes in there too.
Okay,
There you
is
go.
it working? Okay.
Good, good.
Thank you, thank you. Okay, so real quick again, great partnership here, new partnership. Looking forward, really just looking forward to how we're going to continue this when we're fully into the recovery mode. So I don't want to waste too much time talking about everything else going on. We're going to talk really just about the vaccinations. And so right now, you may all have heard that we're in Tier 1C. Originally, the thought, or originally what was communicated was that we were going to open it up after 1B to the 1C industries, hoping that we would have enough vaccinations to go around, that anybody that wanted to get vaccinated as 1C could just go for it. But unfortunately, we're still in the stage where we are not getting as many vaccinations or vaccines as we would like to. So we still are in a prioritization model within 1C, just like we did with 1A and 1B. We're prioritizing those in 1C. We know that this industry is so critical to our economy and our communities, that so many of us have friends and family that are part of these industries. And so when we saw our most recent cluster report, right at the same time where we were opening up the Tier 1C to vaccinations, so I'll share with you. I'm going to swap from this presentation real quick to okay, can you all see this right now, which is our cluster report?
Yes.
Okay, so this is our most recent cluster report that was published last week. And again, this will be made available to you. It's available online, but I wanted to show that what we started seeing in the week prior to this being published was those variants, the more transmissible variants that you've heard on any news outlet, that there's concern where it is maybe a little bit more infectious than previous variants of COVID-19. So what we saw was 9 cases confirmed through our whole genome sequencing of the B.1.1.7 variant. And so this variant, as you probably have heard, is the UK variant. We found also 3 of those 9 samples that we collected were people who had traveled to Las Vegas. and acquired that variant and showed up, as infectious after they came back home. Unfortunately, they also infected some of their household members as well, and that's just part of the characteristic of B117, where in the past other variants, you could have had 50% of a household not be affected by previous strains of COVID. And what we're seeing is that, in fact, more people in the household of people with these variants, it's much more transmissible. So we see that in our returning residents. We haven't detected it too much yet in our visitors, but it's only a matter of time. Just like across the nation, it's just a matter of time. We also have seen, particularly in, I will scroll down here. I want to show you in our cluster report, if you haven't seen it yet, we talk about certain areas that clusters are occurring. So on Maui, besides the MCCC jail cluster that you might have heard of, what we know from our disease investigators and contact tracers is that other than in the jail settings, the clusters seem to be occurring in bars/nightclubs, restaurants, and hotels that are hosting luau's. And when we saw that come out, again, right when we were opening and expanding our vaccination efforts to Tier 1C, this is what the kind of data that had Department of Health say we need to really prioritize this industry for vaccinations ASAP. So going back, excuse me. Okay, hold on a second. Sorry, you're gonna see the slide view for now. That's the reason that we decided in a matter of a weekend's time that we really wanted to reserve spaces at all of our vaccination sites for those industries. So I know many of you have been successful in getting yourselves and your colleagues registered at some of these registration sites like Queens, HPH, Kaiser, Castle, as well as the neighbor islands, because what they've done as a partner is that they have made explicit on their websites that the 1C prioritization, in addition to those 65 and older, it's really for people that are working in hospitality and within the hospitality industry, especially those in hotels, restaurants, and bars. Real quick, some general appointment issues. What you've already experienced if you've been working with HLTA on identifying who in your organization should get vaccinated and how to prioritize them. If you are the point of contact for your company, you play a very important role. The point of contacts, I would say, have one of the most important jobs because it's really identifying all the employees who really should be given that priority appointment and ensuring that either the employees know how to register themselves or get all the information from the employee so that it can be shared with HLTA, who then shares it with us so that we can assign it to the proper vaccination pod. We are working on a centralized registration and appointment system. Unfortunately, with technology, it takes a little bit of time. So we expect that in the next 3 to 4 weeks, we will have more of a centralized registration and appointment system. So people don't have to look at the Castle site separate from the Kaiser site, et cetera, et cetera. They should be able to go to one location and find an appointment. But for the meantime, again, we want to prioritize this industry. So that's why we're doing this presentation and offering ways to get those priority appointments. Another thing I'd like to point out, regardless of somebody's insurance, all COVID vaccinations are free. If you are uninsured, underinsured, or say you have Kaiser insurance, but you get your appointment might be at the Queens operations at Blaisdell, it doesn't matter. It's not going to cost you anything. So everybody on the back end, we take care of making everything right. We don't want payment for vaccination to be a barrier for anybody. So another real general, just kind of some precautions to take when it comes to COVID vaccinations. Don't take another vaccination 2 weeks before, 2 weeks after your vaccination appointment, your COVID vaccination appointment. And that's just to be sure that in case you do experience a little bit of side effects, that it's clear which vaccination you might be having a reaction to. Also, if there's anybody, on your team that is pregnant or breastfeeding or is considering becoming pregnant, I just want to be very, very transparent that the current vaccinations on the market, they do not have any data on, or they didn't specifically look at pregnant women during their clinical trials. It doesn't mean that it's not safe. We know that there are many women who are pregnant or breastfeeding or who want to become pregnant that have been vaccinated. And so the best thing to do is, if you're not sure, you can consult with your physician. And just in general, if you're unsure about the vaccination, because we know there's a lot of questions, you can, the best thing to do is call your doctor in advance of your appointment, because typically at our vaccination sites, there aren't physicians who can, who are available to answer your questions. So that should be done with your physician ahead of time. Also, there's been a lot of information out there about taking Tylenol or ibuprofen or something like that with the vaccination. So the recommendation is please take it after you've been vaccinated. Don't take it prior to your appointment. And, just wait to see if you exhibit any of the side effects. And then lastly, when you are going to your appointment, whether you schedule it on your own or you come through us, treat it like any other doctor's appointment or medical appointment, and have with you a government issue photo ID, your insurance card. And sometimes they'll email you a confirmation. It's good to just have that available on your phone, or if you don't have a phone, print it out, just as a way to confirm that you really do belong at that location at the time. Okay, so there's 2 appointment options that in collaborating with HLTA, we identified the 2 best options to get all of you appointments ASAP. So option number 1 would be the self-serve scheduling option, which I think a lot of you have been doing. And more so as we've refined those websites with our partners, it should be very easy for you to self-attest that you, your employees, are in fact part of the industry that should be prioritized. For the most part, they are not going to ask for any other type of validation when you get to the site. There's been stories that people say, oh, I didn't have my worksite badge that showed I really do work there. But at this point in the game, our vaccination operators should not be asking you for credentials once you're at your appointment. So one of the pros to this self-serve scheduling is, like Mufi said, if you go on some of these sites, you can get your appointment maybe today, maybe tomorrow, and you have a choice of location. So you can, if you live Windward side, you can say, I only want to consider Castle, or maybe some of the CVS locations that are in Kailua or Kaneohe, and that's where I'm going to choose to get vaccinated at. You can also potentially choose the type of vaccination that you would like. Some people have a preference for the Johnson & Johnson single dose. Others would like to get Pfizer or the Moderna vaccination, which is the 2-dose regimen. So some sites, and I'll show you how they do this, some sites actually say which vaccines they offer and even which days of the week they offer those vaccinations. And the cons to this is that, you yourself and your employees will be shopping around for their own appointments. And so there is no guarantee that they will get an appointment this way. However, if for those of you that would opt for number 2, which is sending your list of employees and the contact information for them to HLTA, what we do is that we have with our vaccine operators, they have some appointments on the side that aren't posted online that are dedicated for these priority groups like yourselves. So it may add a couple of days to being able to make an appointment, because what happens is that when it comes to Department of Health, we match it up with where we know that there are appointments available, and we do this statewide, and then we send it to the scheduling coordinator for that pod operator. And as you know, when you're doing things one after the other, there may be, a half a day to a 2-day lag in everybody receiving the information. So that's one of the downsides. But one of the upsides to that is all the people on that list are guaranteed a vaccination appointment. Unfortunately, it also means that you don't get to shop around for a location. But, you know, it's one of those things that we've seen with other industries early on is they liked to the assurance that everybody that's on the list will get an appointment. And if something happens where maybe a vaccination operator, their scheduling system has a glitch, and we find out that, hey, these 5 employees never received notification from a vaccination operator, what you get with this option 2, this list method, is that we actually know who we sent those lists to, and we track them down, and we hound them. We will keep on keeping on with those operators so that they do in fact reach out to every single person that we provide a list to. Okay, so option 1, real quick, I'm on slide 7, so we're halfway through. We continue to expand the number of sites, or what's also known as points of distribution, these vaccination pods, if you would. So we have it on our hawaiicovid19.com registration page. And let me close this and share the actual website here so you can see. So on our hawaiicovid19.com website, when you get to that registration page, so you would, you know, click through the vaccine link. It says how to register for vaccination. I want to point out, we have your industry very, very explicitly cleared, labeled as being priority in 1C. But when you keep on scrolling down, and just for those of you who have employees who may not read or speak English well and have other languages that are preferred languages, they are able to review the information that they will get at the vaccination sites in hard copy. Usually it'll be in English, but we also have it available on our website in various common languages that we see here in Hawaii. So when we get to this point on the website, if again, you were going to do your own shopping around to schedule your own appointment, this is the listing of all the current sites statewide that are taking appointments. Some may be filled appointment slots, like Castle right now. There was a surge of people on the windward side who wanted to sign up for COVID vaccinations. And usually Castle is one of those locations that has appointments available, but for some reason, everybody on that side of the island really jumped on board with the 1C registration. So we have, again, the websites and phone numbers for every single location that is offering a COVID vaccination. So this includes federally qualified health centers. If any of you have employees who live in those geographic areas that are served by FQHCs, they may also go to the FQHCs and register on their own. Some people may have family members that are DOD employees, and so they are separate from our state vaccination allocation, but we do make a list to at least the Veterans Affairs appointment schedule, and that will be something that the Department of Defense, the Federal Department of Defense, manages to provide to its employees and its members. So this is the website. Again, it's on the presentation. You'll have a link to it, but it's on our hawaiicovid19.com website, and it gets updated daily. So here we go. So option 1, I'm primarily covering the Oahu locations, but again, I have information on our website for all of our neighbor island locations if there are questions. So option 1, Adventist Health Castle and Kailua. Unfortunately, 2 days ago, when we double checked in their appointment schedule for both what they have reserved for this priority group as well as their open appointments, they are filled through the beginning of April, but they do offer a wait list. So if you don't mind waiting and you really have a preference to going and getting your vaccination at Castle, there's the information on this slide with their website and their phone number. So again, it's one of the few pod operators that offers a wait list. Queen's Health is operating exclusively out of the Blaisdell Concert Hall now. And so this is one of the really nice sites where they offer a lot of information on COVID vaccinations. And so if you have people that just want to learn more about what the vaccine is, what it isn't, and if they need more information to make a decision, the Queen's website that's listed here has some of the most comprehensive information. It is a self-attestation type of registration process. And I will say, when I tested them out yesterday, just to see how they were functioning, this Queen's registration is one of the smoothest running right now. It did have some bumps along the way. I think based on your feedback, actually, we were able to help make improvements to the Queen site. So it is a really nice user-friendly option for registering yourself and your employees to register themselves. The other location that people can self-register, which is considered a large pod, will be the Hawaii Pacific Health location at Pier 2. So Queens and Pier 2 for now are going to be the most convenient locations to Waikiki. They offer free parking. They have a pretty good spread of appointments, if you would, so that it can accommodate people that might be working different shifts. And so this is an example of a pod operator that actually set a schedule so that they have Moderna on Saturdays, Sundays, and Mondays. And they take a break day on Tuesday because that's usually when the vaccination is being delivered, or the vaccines are being delivered in Hawaii. And we're doing all of our back office distribution on Tuesdays. And then they do Pfizer on Wednesday, Thursdays, and Fridays. So if people have a preference on which vaccination to get, they do offer, it's very clear so that you know how to schedule yourself. Another option for self-registration is Kaiser Permanente, which typically has locations in Central and West Oahu. They are standing up next week a pretty large operation in Kapolei. So if people live out that way, and there's also, you know, some industry that works out on the west side, this could be a really good location. You don't need to be a Kaiser member to register to get vaccinated there. It's not going to cost you anything out of pocket. I will say, though, that one of the great things about Kaiser being an HMO is that they have a big interest in taking care of everybody. It's not just about that one service they provide you. They really want to take care of you for life. So what that has created, though, that spirit of Kaiser does translate into a slightly longer registration process for those people who are not Kaiser Permanente members. If you're a Kaiser Permanente member, it's pretty streamlined. It's going to be like any of your other Kaiser appointments that are scheduled when you log in with your member ID. But if you're a non-Kaiser member, it is, I would say it takes about 15 minutes to go through the full registration process. And that's really because Kaiser is, you know, they have a very, very holistic approach to how they interact with their patients. So then option 2, which is the list option, and it's been working well so far. It's, you know, thank you so much to Jared, who also works at HLTA, who has been my point of contact for figuring out how to get lists from different businesses. So for the nice thing with this option, again, like I said earlier, is everybody on the list is guaranteed an appointment. They don't have to fight for it. They don't have to shop around for it. We assign them to all the aforementioned locations that I just shared for option 1. But what we also have is government-run operations at Leeward Community College and the Windward Health Center, so that we can really focus on the priority work group. So these are, we don't just open them up for anybody to shop around to make appointments at. We keep these locations primarily for industries like yourself, where we want to guarantee a big number of appointments that can be available within, you know, 48 to 72 hours of getting those lists from you folks. So again, those are free locations. There's no charge to get your vaccination at those sites. But the one thing is that as a point of contact, you must provide the information as shown in the screen, and HLTA has the Excel spreadsheet. If they have not already shared it with you, they have that to share with you about the template that we would like to get the information just so that it can be expedited into the registration system. Okay, Tier 1C expansion, I've mentioned hotels, bars, and restaurants as the priority subcategorization of the industry, and it's because of where we've seen these clusters emerging. But what I'd like to also share is that what we're talking about is really a prioritization that's going to last a matter of weeks, not months, or, it's not like you're going to get pushed all the way to the end if you're not in the hotel, bar, or restaurant industries. We anticipate that with the vaccinations continuing to come into our state, that it'll be about 1 to 2 weeks before it's really just opened up to the rest of the hospitality and the visitor industry. Hopefully it'll be sooner if we get the Johnson & Johnson shipment. I believe it's scheduled to arrive in about a week and a half, but that has yet to be seen. We got one shipment and there's been a gap of 3 weeks. So we are not 100% sure about that Johnson & Johnson delivery. So I can't tell you with 100% certainty when we'll be able to open up to 1C completely. But I just want to share that information so you have it and you know that it's not going to mean that months and months and months later, you're still going to be waiting. There are age-based appointments available at all these locations, but CVS in Hawaii has been the location or the locations, the company that has been primarily trying to vaccinate people based on age risk. So they have appointments available for people 65 and older. They release appointments every week. So right now, I think all CVS locations offering vaccinations are booked for this week, except for Waianae, which still has a few appointments available. But what they do is they release more appointments every week, and people can self-register there if they meet the age criteria. High-risk medical conditions, if anybody is, they're on dialysis for kidney disease, they use oxygen. They're actively using oxygen for a lung or heart disease, or if they have cancer or some sort of autoimmune disease, they qualify as well as part of 1C. So hold on a second. So actually that's the end of my presentation and I'll open it up for Q&A. Thank you.
Kathy, before we go to Q&A, Keith, I see we have 2 questions in the box, if you wouldn't mind asking that. But I'd also I noticed that Donna Domingo is not registered or not in attendance right now. If any representative of ILWU would like to speak on her behalf, please identify yourself in the chat box. And while Keith is asking these questions that have been submitted, I'd like to also invite after that to have Cade Watanabe represent Local 5 and any specific questions you might have. So Keith, at this time, if you would present the questions in the question and answer box. Thank you.
Certainly, thank you, John. So the first question that we have is, do hotels still need employer codes for employees to get vaccines? And then we never received contact from DOH HLT to assist in uploading our employee roster. So Kathy?
So Queens was one of the few sites that previously required a special code. And that was because there was a lot of sharing of links, if you would, before people could self-attest that they were in an industry. So now that we've worked with them and there's self-attestation on these websites, we are relying on people to, the honor system to self-attest that they qualify. So there should no longer be a need to provide some sort of special code. And I'm sorry, Keith, what was the second part to the question?
I got to go back here. Hold on a second. It's just asking for some assistance from DOH and HLTA with uploading the roster. What I'll do is, Kathy, I'll send you that information afterwards, and then maybe if you can reach out to this individual, that'd be great.
Perfect.
Okay, so the next question is, and I think you sort of touched on this, Kathy, but
Keith, before you leave that, Keith.
Yes, I'm sorry. Go ahead.
Whoever asked that question, basically is just get the list to us here at HLTA. And we've been doing that. We've been forwarding lists to Kathy every day. So we get a list, we can forward it to her, and they'll take it from there. That's the easiest way to do it.
Thank you, Mayor. Appreciate that.
Thank you.
which site is offering the Johnson & Johnson vaccine? I think you already kind of touched on that a little bit, but it's a question that came up again.
Sure. Right now, only our state-run pods have been offering Johnson & Johnson, and that's because it was a one-time shipment, and we really don't want to distribute it broadly until we know that the federal government will be shipping us what we expect to receive. And so it's part of it is that it makes it difficult for these larger pod operators like HPH and Castle and Queens to schedule Johnson & Johnson appointments when they have no idea what the shipment schedule will be like. So hopefully in about 2 weeks time, after we receive that first, that I should say the restarting of the shipment to Hawaii, and we are told what our 3-week projections are for Johnson & Johnson, we'll be able to distribute those more broadly to, excuse me, to non-governmental pod operators.
Great, thank you. The next question is, do you need a Hawaii driver's license as an ID?
You do not need a Hawaii driver's license for an ID. In general, the federal government allocates vaccine, the quantities of vaccine based on our population. But we also recognize that there are a lot of people that don't have a Hawaii state ID or driver's license. They may have recently moved here, or we know that there are snowbirds as well. So while we are focused on vaccinating our residents first and foremost, we also recognize that if people qualify and they're able to get an appointment, we're not going to turn them away.
Great, thank you. The next question is for persons who want to register under the high-risk medical conditions, such as those who are oxygen dependent due to lung or heart disease. What additional documents will be required? Doctor's note presented at the appointment site as an example.
Originally, some sites did require that, but again, as we work to make the self-attestation process much more standardized across the different sites, we are now just relying on people to be honest about that.
Great, thank you. Next question is, what is VAMS, V-A-M-S, and how is it different than other enrollment systems?
Sure. So VAMS is a product that was created by the federal government, and it's a Vaccine Administration Management System, real fancy government names, right? And so that was the intent was that it was an option for all states and counties to utilize for registration and appointments. It is not a requirement to be used by everybody, but it was a product that was made available. So you hear it quite frequently because many jurisdictions did opt in to use it.
Great, thank you. Next question is, based on current legal privacy requirements, how are we getting around the privacy issue if we were to send you our associate list with their personal contact information?
Hi, so we are requiring just first name, last name, phone number, email address, and a zip code could either be a person's work zip code or their home zip code. We don't, it helps us if we start to be able to parse out which geographic location might be better suited for a group of people or a list. And so those records are kept in very secure, confidential Department of Health electronic record system. So you don't have to worry about it just floating around there. One thing that Department of Health is our systems are set up to protect information, but we don't share any other information besides what just to be able to get somebody registered into the system.
Thank you. John?
Keith, I'm sorry. Before we go on to the other questions, I wanted to call on Kate Watanabe from Local 5. If you had specific questions of Kathy at this time. And welcome, Kate. Kate, you're muted. Yeah.
Oh, hi, everybody. Hi, John, Keith, and Kathy. Thank you for having us. And, I think the thing that we found is that whatever information we can pass on to the members, that's been helpful. And I think the other thing is that we've appreciated the state prioritizing hospitality, restaurant, and bar workers. We know that there's plenty of interest for folks to get the vaccination, and so we definitely appreciate the state taking that position. But we're here to gather as much information as we can. We have some members that have joined us, and so if we're able to, I guess, encourage them to put their questions in the chat, and maybe Kathy and Keith and others can help continue to answer them. The one thing that I would say, John, if I could, and thank you to the HTA and the HLTA for helping to coordinate some of this, is that we are hopeful that the DOH and HTA can help continue to encourage our employers to do what they can to allow and accommodate folks to take the vaccination, recognizing that the amount of supplies is still very limited. People's ability to get the vaccine quickly makes sense for workers, makes sense for our community, makes sense for our employers, because we want to make sure we can keep the guests coming to our island safely. And so we would really appreciate it. We are working with our employers, those that we can, to make sure we come up with a sensible approach that allows workers to take the time off they need, even if they're working, to be able to quickly get the vaccination and come back to work. Again, I think if we were in a different space where vaccinations are readily available, then that may be very different. But I think we're in a very critical point where we're hopeful that DOH and HTA can help us communicate that message publicly to our employers, that please work with the workers, let them off if they can, especially in this time when our vaccination supply is still somewhat limited. So,
Super, appreciate that. And what you should also know, and everyone should know, is a video of this webinar is going to be posted on the HTA website. We're also sending it to HLTA so that Mufi and his team can post it on their website, as well as direct distribute it to their members via a video link. We'll do the same with Local 5 and Local 142 so that you can get this timely information out to your, to the members. And so thanks, Kate, for that. And Keith, I know we've got more questions that have appeared, so let's get back to the Q&A.
Yeah, lots of questions. Thank you, John. Thank you, Kate. Okay, so the next question is testing open to visitors or a visitor who took vaccine from point of origin and needs to take second dose while here? I think maybe there's kind of two questions there. One is testing for visitors. Is it open to them? And then the second question is, could a visitor take their vaccination here or their second dose here? Sorry, that's the second question.
Okay. Testing is still available. I should say in every county. I can't say specifically every single island, but every county offers different versions of testing. There's tests for people who may be feeling ill, and they do more of a traditional diagnostic test. And then also, there's entities that have popped up that are doing other types of tests, like for travel or just for people that are curious about their risk for COVID infection. So all of that is available. CVS and Walgreens, they are major partners nationally as well as locally that offer different types of tests. And again, the county and the state have been paying for testing. In fact, I think your industry probably has been made very well aware of the free testing that the National Kidney Foundation of Hawaii has been offering at one of its Waikiki locations, as well as at the airport for people that are in the hospitality industry. It's been open as a free option for people to get tested, for educators as well. And if I could use this time to promote that, tomorrow and Saturday, and then the following weekend, because this is spring break, we have free testing available at UH West Oahu. It'll be posted on the Department of Health website, but we are offering free testing at UH West Oahu for people to, especially as they consider, say going back to school, or if somebody went on a trip and they did their pre-travel test, it's negative, but they still want to do that second test, 3 to 5 days after returning. that would be an option for them as well to go to that location, just to be sure. Yeah, and then the part about the second dose for the vaccination, that is something that it's one of the few things that we discourage for somebody that has gotten their first dose in another state to then try to get their second dose here, because the way that the first dose and the second doses are matched, I mean, they really are matched up. So when we start getting too much deviation of somebody who, so if you get your first dose here, the federal government, and this is where somebody asked about the VAM system, ultimately all the data, we push it to the federal government. But what happens is when they see that we've administered the first dose, depending if which vaccination it is, 3 or 4 weeks later, they are guaranteed to ship that matching second dose for the first dose to Hawaii. And then we are in turn doing the same to our different vaccination operators. So what happens if too many people are trying to get in just for a second dose, it actually kind of messes up the allocations. And so we ask that to the greatest extent possible, people get their second dose at the same location they got their first dose.
Great, thank you, Kathy. Next question is, will there be a Waikiki pod scheduled? This would cover the many hotels in the Waikiki area and would be well received.
You know, that's something that we could talk about, to stand up a pod. If any of you have seen the operation at the Blaisdell or at Pier 2, it's a very, very involved operation to stand up, because it's not just about the person putting the shot in the arm. There's a lot of other stuff that goes into it, and it's, but it's, I'm not going to rule it out, you know, either. It's really about, is a site conducive to it? And then are all the other elements available for us to do that? And the other thing is, we're still, I think as Kate mentioned, right, we're still not at a place where the vaccine is so freely available that it could just be for anybody and everybody, that we still don't even have enough vaccine to maximize our current pod operators. They still have a lot of extra capacity if the federal government would just, you know, continue to increase our vaccination allocation. So again, I'm not going to rule it out, but right now, I would say in the next 2 weeks, it is very unlikely that we could stand up a pod in Waikiki, and we want to get you guys your appointments, you know, right away. So, but we can continue to talk about this, Keith, you know, see when the vaccines become more readily available, how we might be able to support that.
Great, thank you, Kathy. Next question is it possible to have you work with the employers to give the workers time off for their appointments during their working hours and not get penalized for taking off to get the vaccine? Maybe Mufi, you want to try answer that one, or?
Sure. Yeah. This is a question also that Cade was addressing. So we know that they know that this is a priority, and certainly this is something that has to be factored in. So what I would say to Cade and whoever is asking this question, you know, please let us know specifically what hotel may not be being as flexible and such an important issue, and more than happy to talk to them, because as far as we know, everyone is making this a priority. We've been waiting a long time to get the word that we're finally in the queue, and we know Department of Health is working very hard. So I don't want anyone to feel that they're not going to be able to make their appointment because they're not getting the cooperation from management. So please let us know here at HLTA, and we'll get on it and make it a priority to speak to that specific hotel that may not be as accommodating.
Thank you, Mayor. Okay, the next question is there any option for employees to register for an appointment without receiving an email to pick out an appointment time, aside from going through their doctor's office, as an example? Because there are some colleagues who may not be as technologically savvy.
And that's where I think maybe for those of the, you know, for the participants on this call, you might be the point of contact that's coordinating this for members or for your colleagues. And so what we've done, even I'll use an example with, there are several state agencies where not all employees have an email address, and they don't even have a business phone number necessarily, but they do have a supervisor who has an email address and a phone number. And so what they've been able to do, and that we are also supporting for this industry, is somebody could register somebody else. They could serve as I guess like somebody that could just say, hey, use my email address, I'll help you get on the system. And I don't know that, I mean, that to me is more of an employer-employee discussion, but there are, it's very, very doable for somebody to assist somebody who's not tech savvy.
Great, thank you, Kathy. Is there a contact for companies to send employee information directly to DOH?
In the past, we, because there were so many inquiries from different companies, we did have a quote unquote, it was called a survey that was posted online, and people could submit their point of contact information. And for industries in 1B, they were submitting Excel spreadsheets of their employees. But now that we've expanded into 1C, that feature has been disabled. And so for this particular, for tier 1C, it really would be the two options that we presented in this, where people go to these different sites and register themselves or submit your list through HLTA.
Great, thank you, Kathy. The next question is, if I work and went back to work, can I register my kids to get the vaccine, or do they have to wait?
Well, for right now, I'm not exactly sure what if my answer is going to satisfy the question about pediatric vaccinations. So right now in tier 1C, children 16 and above are eligible to get vaccinated if they have one of those three categories of diseases. So it's really looking at risk and who are at the highest risk of a severe COVID infection if they were to be infected. So in phase 2, or I should say, I keep on saying phase, in tier 2, when it gets opened up after tier 1C, after we get through majority of tier 1C and phase 2, as tier 2 is open, that's where, anybody 16 and above could go and schedule themselves for vaccinations. As it relates to younger children, there are pediatric clinical trials that are going on. So there is no definitive date, but what we've been seeing from our national colleagues is that they're saying maybe this fall, the older pediatric population could theoretically begin to get vaccinated. And then maybe next spring would be the younger children that would be, there would be a vaccination available for them. So we continue to be poised to support whether it is pods for pediatric populations, or if it will be a more decentralized model, like going through pediatricians' offices or retail pharmacies. We are preparing for all of those options for our younger population.
Great, thanks, Kathy. Under the classification of hotel, are departments such as hotel admin, sales and marketing, accounting, etc., not frontline staff included? I don't know who would like to field that question, but. I'm sorry.
Keith, yeah. So what we told the hotels is basically to put everyone on the list, especially those that are working. And then, of course, eventually, the priorities are those as outlined by DOH, which they want the hotel and restaurant and bars. But our recommendation has been to put everyone on. Those are working, those are not working, what have you, so that as the vaccinations become available, we can get to them. So don't hesitate to put that on the list, and we'll leave it to Kathy to make the tough choices when they get to get their shots.
Great, thank you. Thanks, Mayor. Okay, the next question is, how can we network with the workers who are not computer savvy and don't slip through the cracks and get vaccinated? Maybe, Mayor, if you've got some thoughts on that.
I would say, especially with the hotels, you all have a director of human resources, a human resources department. I would go to them and ask them. And the way to do that too is that if there's a number of employees that are in that category, and of course they are, then they can submit the list to us, and that's the way we can get them all in the system. Other than that, it's fairly easy. It just takes someone just kind of walking you through it. And certainly, we'd be willing to do that too here at HLTA. Whatever, our feeling is this: whatever we can do to make everybody feel comfortable and not, be fearful about their lack of tech skills, what have you, because this is an opportunity we want to take advantage of. So go first to your human resources. If that doesn't get you anywhere, then come to us, and we'll have our crew of tech savvy people here help you.
Great, thanks, Mayor. Next question is, how can we get more workers vaccinated who are not yet at work, so that workers can take vacation, or people who call in sick will have coverage, and just kind of having a pool of workers available to be on callback as business needs warrant. Maybe it's either for you, Mayor, or Kathy. Thoughts on that? How to get more workers beyond those who are like currently actively working, but are technically within that industry.
Yeah, I think, again, as I stated earlier, DOH wants to, and Kathy laid it out pretty well, the rationale for hotel, restaurant, and bar employees. But we want all of the employees to be on the list wherever they're employed at, because eventually they will get to you. That shouldn't be a reason why you're not going to be placed on the list, or we're going to forget about you. I don't want anyone to feel that way. And that's been our instructions. We'll continue to reinforce it. Put everyone on the list. The priority, as we know now, is hotel, restaurant, and bars. And in ongoing dialogue we have with the Department of Health, as supply becomes available, they'll move into the other aspects of the hotel operations, especially on the back end and the like. So this is our opportunity to put everything down on paper and not wait till you think it's been hotel, restaurant, and bar employees are vaccinated before you're going to be on that list. Be on that list, so when they call, you're ready to go.
Terrific, thank you. John, that's all the questions that we have. Before I turn it over to you, I just wanted to mention that we did drop Kathy's presentation into the chat. So if anybody's interested in picking it up there, you're welcome to do it through there. Or alternatively, as was mentioned, it'll be made available on our website, as well as through our partner websites as well. So, all right, John, thank you. Thanks, Mayor. Thanks, Kathy. Thanks, Kate.
May I just say something real quick? Appreciate that Kate is here from Local 5. Thank you, Kate. But I also want to recognize that John Simpliciano from the IOW has been taking copious notes too. He's here representing Donna Domingo. So thank you to both Local 5 and IOW for joining us today.
Thank you, Mufi. And as mentioned earlier, we will get the video presentation to both Local 5, Local 142, HLTA, and anybody that wants it, frankly. It'll be posted on the HTA website. Feel free to share it with everyone. Most of all, thank you, Kathy, for your exhaustive work and for taking the time with us. This is the first of 2 webinars. In an hour, we will be focused on the retail, restaurant, attraction, activities segment of our industry. But thank you all for joining us, and stay safe and healthy and get vaccinated. Okay, aloha.